Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everyone. Happy Friday. It is a beautiful day outside. So glad I was able to get out and walk the dogs before the show this morning. It is finally not brutally hot. Oh, I am so grateful for that because I don't do well in the heat, as I think I've mentioned to you guys before. Well, it's 9 a.m. on Friday, so you know what this is. This is Friday Friends, and I'm Deb Burton, the host of the show and executive director of RI Elder Info. And you all know RI Elder Info maintains the most comprehensive resources for seniors, caregivers, and professionals, right? Yeah, of course you do. And you're going to hit the like button and the share button and hit the bells and whistles and all of that to make sure that your friends, neighbors, loved ones, everybody hears the show today. We're talking about some really important programs that are available out there for free. Yep, I said free. And they are much needed services. So really important that you hit the like and the share and all those fun things. Now, we are a nonprofit, so we cannot do what we do without the support of viewers like you and our wonderful sponsors. So a big shout out to Aetna and to United Health and to Oak Street Health and to Tamarisk Assisted Living and 321 Media and England Studio. What we do would not be possible without their support. They are absolutely amazing organizations, and I encourage you to check them out. So I would like to introduce everybody today to Jody Eyre, the new executive director at Child and Family Services. Welcome, Jody.
Hi.
Hi,
Hello,
how are you?
everyone. Hi. So I'm Jody Eyre, and I'm the director of the Aging Well program at Child and Family. And I'm here this morning to talk to you about some of the programs that we offer at Child and Family. We have two offices. We have one in Providence and one in Middletown. So those are our regions. The Aquidneck Island, Jamestown, and Little Compton are included in our Aquidneck Island office. So we take care of every senior who needs home health care, CNA services, or needs assistance getting into an assisted living and staying there. We also run a program through the Office of Healthy Aging called Protective Services. And that program is like a DCYF for older adults. I'll explain more about that program. We also have a couple of different home-based outpatient programs that we run in both offices, and I'll talk a little bit more about those. We have a VOCA grant, which allows us to help older adults who may be victimized. So, and that one's just in our Middletown office.
So do you find that there are a lot of older adults who have been victims of elder abuse? Is that something that is common?
Well, it depends what you mean by common. I mean, it's regular. Like, we regularly get referrals for older adults who have been taken advantage of. So all the information you hear about, like people who get scammed out of money, that happens. So I would say it's a regular event.
That's really kind of sad that elder abuse is something that has become regular. And I think that makes it maybe even more important to talk about, is that like this happens to people regularly. And if somebody's a victim of elder abuse, those scam artists and things like that, then it's really important for people to do something, to take action, and not feel like, oh my God, I got taken advantage of, and what are people going to think? Like, there are scam artists who do this for a living. Like, they go to work to scam people.
Yeah, no, Yeah, some of the scams that people fall for look really realistic. So it's not a big lapse of judgment usually to fall into to fall prey into a scam system for sure.
Yeah, absolutely. So you mentioned Child and Family Services can also help people get CNA services. How do you do that? Do you have social workers on board? What exactly do people need to do if they need home and community based services?
Right. So if you have the funds to hire a CNA yourself, then you would just reach out to a CNA agency. If your income doesn't allow you to be able to afford that, then you'd have to apply for services through the Office of Healthy Aging. Now, they have two programs that allow a CNA agency to send out a CNA into a home. One of them is for people who have the lowest income, who would make criteria for the Medicaid program. And then we have another one that is for people who are a little bit above the Medicaid level, where they have a part share in the hourly rate for the CNA. But both of those programs would be started through contacting the Office of Healthy Aging. And then they would send the referral to the organization that handles the region where the person lives.
So for people to contact the Office of Healthy Aging, how would they do that? What number would they call?
Well, I don't know the number off the top of my head, but it's very easy to Google it and come up with their website. And they have a pretty good website that has all the information that people need to start a referral process.
Okay. Okay. So they can check that out. I think that's oha.ri.gov. And so once someone contacts OHA, do they then, OHA refers that to Child and Family Services, and then do you send someone out to the house to help them with the paperwork, or how does that work?
Yeah, well, it depends which program they're going to land in. Our first step is to reach out to the person to try to get a sense of what their assets are and their income, to see which program they might fall into. If it's a Medicaid program and they're brand new to the system, we'd have to start a long-term service, the LTSS application for them to be approved for Medicaid. So that can take a while to become approved for Medicaid, can take a couple of months. And people need to have proper documentation, and it gets rolled into a lot of other functions, like having to have a doctor sign off on it. So it is pretty extensive in order to be able to line it all up. But when it works well and people get the approval for Medicaid, then the CNA agencies who hire the CNAs are informed, and if they have somebody that can staff the person, then they would start services at that point. But it can take months from reaching out to OHA until you have a CNA in your home.
Yeah, and I think part of that is the function of the healthcare workforce shortage, which we've talked about before on the show.
Mm-hmm.
It is really pretty severe. I think sometimes the misperception is that if, say, for example, I was filling out an application today, August 12th, for home and community-based services, that, I would have somebody be able to come help me or my loved one in like the next week or two. And in reality, just getting the Medicaid application through, about how long does it take for the Medicaid application to go through? I think they have like a set time, a standard answer, I should say, on the set time it takes.
Yeah. So the answer to that kind of depends, because for some people, they don't have the documents that they need in order to even start the application. So somebody has to have a copy of their birth certificate, their social security card. So sometimes getting this application done involves making an appointment with the social security office to go in to get that. So if we assume that everybody has the correct documentation, and then we can go out and do the assessment required. And if the doctor sends back the form that we need from him or her, it can be, a matter of months for the approval. That's the best, fastest case scenario.
So if everything works right in a perfect world, because we know everything works right in a perfect world.
Right.
If you apply today, August 12th, then you might hear something back by like Halloween. And that doesn't mean that there's necessarily a home health aide at that time to come out.
Right. Yeah. I mean, or Halloween or Thanksgiving, right?
Okay.
One of those. Yeah.
Yeah. And I think that's really important for people to understand that it's not a fast process.
No, unfortunately, it's not. And I could explain the whole system, but I wouldn't want to bore everybody to death. But yeah, the whole application like ping pongs around between DHS and EOHHS and then the Office of Medical Review. Yeah, no, there's just like a lot of scrutiny about the application that happens.
And so, do you have caseworkers in Providence and in Middletown that can help people, like go out to the house, help them do that? Like at least get started.
Yeah, yep. That's been part of our function for many years. I know that the state is planning to change the way the whole system operates, and the plan is to take away the need to have case management agencies conduct the LTSS applications. That the state, from the way I understand it, is going to be relying upon the United Way and specifically the Point. And so my understanding is the Point will take over the LTSS applications, and in the future, at some point, case management agencies will be referred people who come Medicaid eligible.
To help them navigate finding a home care agency, that kind of thing.
Yeah. So I think for people who want to start the process, they could either reach out to the Office of Healthy Aging, or they could call the CAP agency that is responsible for the work in their region. And if you don't know which agency that is, you can always just find that out through the Office of Healthy Aging. Or you could always call 211, because United Way oversees the Point, and the staff there can help with those LTSS applications.
Awesome. And RA Elder Info also has that listed on the website. Every city and town is listed, and the case management agency that oversees them too, as well as, of course, the Office of Healthy Aging. So you have a new grant program, I hear, happening for folks in Providence that's really kind of unique. Can you talk about that?
Yeah, we actually have a couple of new grants that we're really excited about. One grant is through the Rhode Island Foundation, and it's called Breaking the Cycle. So this grant allows us to send out a master's level in training clinician who can meet in the home of an older adult. And that program, the only criteria is that the person lives in the city of Providence and is age 65 or older. So we're really excited about that. And if somebody wanted to refer somebody, I'm going to just put my email in the chat. You could just email me and we'll take it from there.
Yeah.
We have another grant, which is a collaboration between Child and Family and Newport Mental Health, and that's called the SAMHSA grant. Now that grant is more of a wraparound service where they would get a home-based clinician, a home-based case manager, and they also don't have to have this go through their health insurance because it's grant funded. and the age for that program is 65 and older. That grant works in the Middletown office, so they'd have to live in on Aquidneck Island, Little Compton, or Jamestown.
Okay. Did you say you go up to Tiverton as well?
Mm-hmm.
Okay.
Yeah, Portsmouth, Tiverton.
And if people need this kind of help, is there a cost involved, or can they use Child and Family Services for free? How does that work?
Yeah, so since those two programs are grant funded, there's no cost. So this is like a really beautiful component of the grant. There's no authorization, there's no copay, there's no deductible. It's essentially like free for the people who receive it.
Awesome. And is it a 1-year grant? How long can people get the help they need?
Yeah, at this point, the SAMHSA grant is a 2-year grant, and the Breaking the Cycle expires sometime next year. But we would hope to just reapply for the funding.
Yeah, that would be great. And what kinds of things can these, and you said they're LICSW students, or?
Yeah, so they could be somebody in a master's program for mental health counseling or marriage and family therapy, or for an MSW. And for the SAM grant, you also get a case manager who can help with any case management needs. The Breaking the Cycle in Providence is designed to be therapeutic, so it's designed to be assistance for anybody suffering from social isolation or feelings of sadness or worry, just any kind of behavioral health care issue.
Oh, that is awesome, because I'm part of the behavioral health work group on the Long-Term Care Coordinating Council. And one of the things that we look to resolve is meeting the needs of individuals who have mental health disorders, or are experiencing, as many people are, social isolation and loneliness.
Yeah.
Depression and anxiety have increased during COVID. So we're really looking for resources to meet that need. So is that program up and running? If someone identified that they're in need, can they call you today?
Yeah, absolutely.
Okay.
Yeah. And I think in both those programs, we have the ability to have somebody go out within like 10 days and to get it started somewhere in there. It's pretty direct.
That's
part
awesome.
of the problem with behavioral health care for people with Medicare is that when Medicare was set up at the time, there were only the Masters of Social Work. So written into the program designs is that Medicare will reimburse for somebody who has a Masters of Social Work. Now, the mental health population, the marriage and family therapy population have been working to change or include the two different licenses in order to be able to provide to be able to receive reimbursement to provide therapy for older adults. But right now it's only the master's level social workers who are able to do that. So that needs to change too. And I'm not sure why it's taken so long. I know that both those organizations have been working on it for decades with no real progress.
It's really very challenging, and we really have seen the need increase. And so, like, I'm really excited about the programs the Child and Family are offering. So for these programs, do the individuals need to be Medicaid approved? Or you had mentioned something at the very beginning that if people are able to pay for services themselves, then it wouldn't necessarily be a function of Child and Family to help them. So can people who need help but maybe are not Medicaid eligible receive the services through this program?
Absolutely. Yeah. So there's a separation for people who need the CNA services that would mostly include the need for the Medicaid, but for these counseling services, people don't have to have a certain socioeconomic bracket that they're in. It's independent. We're offering it independent of any resources that the older adult has.
Okay. Okay. And what languages are the resources available in? Because I know sometimes it's challenging to get clinicians who are multilingual, and yet the need is there.
Yeah, we have a Spanish speaking clinician in Providence who can offer the program. In Middletown, we don't.
Okay.
But then in Middletown, we don't tend to have that need, although I know the demographics are changing down here. So I would anticipate that will be changing in the near future. But yeah, we were able to offer Spanish in the city of Providence.
Yeah, awesome. And so does Child and Family work specifically with the colleges, or is it like a specific program through the Department of Labor and Training, so that if there's a student out there who wants to participate in this program and work for Child and Family, how would they go about doing that?
Yeah, we have a director of interns and volunteers here at Child and Family. So all they'd have to do is go on our website and make a phone call and leave a message or speak to the receptionist that they're interested in obtaining an internship at our agency. And Child and Family is very unique in that we service people from like the very young to the very old. We have a child care here in Middletown, Sandpipers. So I think that the youngest ones there are like six weeks old, although I could be wrong about that. And then some of the older people in our department can be up to like 100 years old. So Child and Family has programs for people all along the way.
And that is one of the things I think that makes Child and Family services really special, is that it really does follow the entire life continuum, from birth till the end. And I think that provides a great opportunity for continuity as needed. How long has Child and Family Services been around?
Over 150 years.
Wow. Did it start in Providence or Newport?
It started in Newport as a resource for orphaned children.
Wow. Okay. Okay. So it's quite possible that some of the early users of the service are now coming back around for the older part of the services.
Yeah, it would be great to be able to track that. Like, did somebody receive services as a child and now they're a grandparent, right? Or their grandparent had the services and now they're a grandparent, right? Yeah, no, that would be really exciting to track that.
Yeah. And it's funny, like we think about being able to track data and that kind of thing as like a punch of a button on the computer. But it really wasn't all that long ago that everything was paper-based. So tracking was not necessarily all that easy.
Yeah, especially for services that long ago.
Yes, yeah. File cabinets, boxes, and then after a certain point, it's records destruction for everyone's safety and security. Yeah.
Yeah, that's true.
So the programs they're two different programs, but they're both very similar. The Providence program is a 1-year grant, I think you said, and the Middletown is a 2-year grant?
Yes.
Awesome. And you guys handle all of that ancillary services for individuals who are experiencing mental health issues, in coordinating care for them and helping them navigate the system, right?
Could you repeat that? I just, one of my coworkers came in and gave me a little sticky that the original name of Child and Family was the Home for Friendless Children.
Oof.
I know.
Oof. That's a heartbreaking name.
I know. I think Victorians didn't sugarcoat.
No. But I have to say that would be a great name to inspire people to donate to help them.
They haven't got even a friend.
That's it. Wow. Pretty harsh.
Yeah. Right.
So is Child and Family Services, you had said that it's the 1 year in Providence, the 2 years in Middletown. And are these students, are they able to help people navigate the system?
For Medicaid and Medicare.
Yeah, and anything else that one might need.
Yeah, absolutely. We offer supervision for the interns, and we would be able to educate them on the ways to educate their clients.
Awesome. And since Child and Family has been around for so very long and at least has a far better name than original, are you guys a nonprofit?
Yep, it's a nonprofit agency.
And so if people wanted to support the work that you're doing, from taking care of the little babies to taking care of our older adults and everything in between, do you have any fundraisers going on? Can people donate? Do you need volunteers? How can people support Child and Family Services and the important work you're doing?
So the answer to those questions are yes, yes, and yes. So we do, I think our next fundraiser is coming up in the fall, and it is, I'm totally blanking on it, even though I was talking to the person who runs it yesterday. But you could just go on our website and you'll find everything about our fundraising. Taste of Newport, that's what it is.
Ooh.
And but yeah, we are constantly looking for people who want to volunteer. We accept donations.
So cash donations, or do you do like food donations, things like that too?
Yeah, I think that the food gets a little bit tricky if it's fresh produce. Like, I don't think we have the ability to accept that, although I could be wrong about that.
That kind of makes sense, though.
Yeah, I know that people give my department lots of things, from adult like hygiene products to mobility equipment. So yeah, we're always open to donations. And yeah, funds are crucial to all the work we do. So we really appreciate the generosity of people who are in a position to give.
That is awesome. Well, Jody, I know that you have a deadline, so you've got to get out to another meeting, and I'm sure it's extremely important. So I want to be respectful of your time. I'm really glad that you were able to come on Friday Friends and share about these programs, because I think it's going to make a big difference in many people's lives. And clearly, just the work Child and Family has been doing for all these years has made a difference in people's lives. Thank you for coming on today.
Thank you so much. And I am really grateful for the opportunity. And I'm going to be mentioned to our CEO, Marty Sinnott, and my supervisor, Vice President Robert Archer. And I'll let them know that that we were able to share this information with you.
Absolutely.
And they'll share in our joy to be able to help to spread the word about the work we do.
Awesome. Sounds good. Thank you so much, Jody.
Right. Thank you.
Have a great day.
You too. Thank you.
Well, everybody, you have heard about some amazing programs coming to 2 large areas of the state. As we know, mental health is something that has really come to the forefront of people's minds throughout the pandemic. Depression, anxiety, mental health is healthcare, and it's important that people get the care that they need. And these 2 programs through Child and Family Services are programs that will help people be able to navigate the system and the services they need and get the help that they need. and helping one another. Isn't that what it's all about? Of course it is. You know that. So everybody, I encourage you, visit my sponsors, check them out. We couldn't do this without them. If you appreciate the information that we're bringing to you every week, please consider donating to rielderinfo.com. It's tax deductible to the fullest extent of the law. And I look forward to seeing you all again next week. In the meantime, be well and be kind.
If you like this video, please follow us on social media and subscribe on YouTube. For more information, visit rielderinfo.com or call 401-585-0509. If you have any questions, email deb@rielderinfo.com.